Introducing MOA benchmarking. MOA benchmarking provides a comprehensive end-to-end solution for self-assessment against and compliance with social care standards, continuous quality improvement, and inspection readiness for adult social care providers across England and Wales. From 2026, access to MOA benchmarking is included in the cost of CareLineLive subscriptions, making CareLineLive an all-in-one home care management system that can also help providers maintain and improve CQC and CIW ratings natively. MOA is also available as a standalone offering for other providers, including for care home operators. In addition to our compliance and self-assessment module, MOA also provides solutions for accident and incident reporting and consumer experience through surveys and our feedback and complaint module. Each of these separate modules comes with its own set of customizable forms and modern dashboard reporting, while also integrating seamlessly with the central continuous quality improvement module alongside the compliance tools. Providers who use the MOA platform receive access to a comprehensive programme of self-assessments, which are aligned with the social care standards or assessment frameworks applicable to them. The programme of audits are continuously reviewed and updated by MOA's expert team of academics, clinicians and consultants to ensure they meet the needs of an ever-changing legislative landscape. Audit programmes can also be customised for individual providers, for example, to exclude tools which examine areas of care and service delivery which are not applicable to specific organisations. And we can even include any internal checklists, assessments and other tools in the programme alongside our standard programme. Providers can configure multiple service outlets or regions within the system, who will each have their own programme of audits, allowing for a comprehensive overview of performance across the organisation. The Home Overview screen provides a summary of each site's data entry progress for the month at a glance. Opening up an individual site, we can see the selection of audits and other tools which are available, along with our progress and the time remaining to complete the scheduled tools. Making our way through a typical audit, we'll see a range of different parts, each with a different focus and methodology, which allows us to examine quality of care through different lenses and form a holistic picture of our performance. The structure and policies components focus on policies, procedures and systems relevant to the audit topic, examining their fitness for purpose and alignment with regulatory requirements. For larger providers, this part of the tool would typically be completed once at corporate or head office level, rather than being repeated at each site. Each of the questions contain extensive guidance and supporting information, which give examples of the types of evidence they should be able to produce to demonstrate compliance for this item. Discussions of contemporary best practices and links to external references and resources. All supporting material is continuously reviewed by the MOA content specialists, meaning providers need only follow the bouncing ball of their audit schedule from month to month, rather than spending inordinate amounts of time reviewing and interpreting the standards and administering their own in-house tools. Comments can also be added to provide examples of evidence to support a particular response, and can include images, attachments, and links to other resources, all of which are visible on your reports. We can also see that each individual question is mapped to specific parts of one or more frameworks or legislative instruments, which we later leverage for overall performance reporting. As we make our way through the other components of audit, we continue to cast our different lenses over quality of care. The reflective questions components focus on readiness to demonstrate compliance and confidence in organisational policies and procedures at the local management level. Interviews examine staff knowledge and understanding. A suitably knowledgeable manager takes a random selection of staff and asks them general questions about their roles and responsibilities with relation to this audit's area of focus, and identifies whether they can provide appropriate responses or not. Finally, staff practice components allow us to examine evidence of our policies, procedures and systems flowing through into actual practice. Typically, this is completed by taking a random sample of clients within the organisation and reviewing relevant documentation for each to ensure the information necessary to provide high-quality care and services is recorded. and that policies, procedures and care plans are being followed. Once audits have been completed, reports are able to be viewed immediately at site, region and whole of organisation levels. The report download screen provides comprehensive PDF and Excel reports of performance on individual audits. A key feature of the MOA tools is our industry benchmarking function. MOA's team of epidemiologists, data scientists and analysts design and continuously refine our benchmarking algorithms to ensure providers can not only get an indication of their performance against the standards themselves, but also how they compare to other comparable providers in a statistically robust and relevant way. The web reporting tools provide mid-level overview of performance across groups. These reports allow for comparative reporting between sites and regions, as well as higher-level risk theme analysis, and variability of results with regard to the industry benchmarks. Finally, Dash provides reporting at the level of the standards. This powerful reporting tool leverages the question-level mapping of audit content across up to a year of self-assessment data against the applicable standards and legislative frameworks to provide an overall performance of compliance and risk against these requirements. Providers can then drill down into the details of each individual standard to see where their strengths and weaknesses lie, and see an overview of the individual audits that have contributed to these results, along with their performance and weighting for these tools. MOA's Plan for Continuous Improvement, or PCI module, allows providers to review the flagged areas of risk and opportunities for improvement and push these directly into their online continuous improvement plan. The planner supports you to discuss the improvement opportunity, assign overall ownership of the improvement action, and various subtasks to individual team members for collaborative completion. Monitor your progress, and ultimately to conduct an outcome evaluation once a task has been completed. Management staff have access to the complete PCI register and summary screens, which allow for quick overviews of the progress of various tasks and whether deadlines are being met. These functions are also valuable for providing high-quality evidence of continuous improvement actions to inspectors and other stakeholders. The PCI dashboard provides a high-level summary of quality improvement actions across the organisation, including completion progress and summaries of activities by standard or other themes. Users can drill down into the individual components of this report to view a summary of the relevant actions. MOA benchmarking is available as an add-on to all CareLineLive customers as a cost-effective solution for managing compliance and inspection readiness. For more information on the system or to discuss our ancillary modules, including customer experience and accident and incident reporting, reach out to the team today. www.moabenchmarking.co.uk